Let's get started. So as you just heard Stephanie say, so I am an arbovirologist. I study mosquito-borne viruses. And as many of you know, mosquitoes are the most deadly animal in the world. And that, of course, is because they carry pathogens that kill, including malaria and many of the viruses that I study, yellow fever, Rift Valley fever, Zika, dengue, and so forth. But these mosquitoes and their pathogens don't just kill, they actually maim people. And this is often unrepresented and underappreciated. So sometimes when people survive these infections, which many people do, they actually get left with long-term medical consequences from them that can impact their brain, such as, of course, all the encephalitides that they cause. Rift in particular causes a lot of tremor. Rift also can infect the eyes, leading to blindness and retinitis. Chikungunya and the erythrogenic alpha viruses can lead to long-term joint problems where people have problems with activities of daily living for years after initial infection. And then with Zika, we saw not that Zika is the only arbovirus that can cross the placenta, but it definitely does it well. And so we saw a lot of impacts on fetal neurodevelopment, of course, and all of the terrible implications of that. So I started working in Kenya a very long time ago, actually, and as part of my infectious disease training. And, you get bitten by mosquitoes there, right? But, what if the fever is not malaria, right? Most of the time when you have fever and you're getting bitten by mosquitoes, most people are thinking it's malaria when you're in sub-Saharan Africa. But what if it's not? And what about if that net, these are my 3 boys when I brought them to Kenya a while ago, what if that net isn't going to protect you because what's actually biting you are day biters carrying different diseases, right? And so that's what we're going to talk about today. I've mainly been studying dengue and chikungunya in Kenya, but when you look broader in Africa as a whole, Africa's population growth and unplanned urbanization, habitat destruction, and transborder travel really are contributing to a rise in arboviral outbreaks overall. WHO used to estimate that about 20% of the population was at risk, and there were about 1 million cases of symptomatic dengue. But new estimates came out, and actually, it looks like there's a lot more transmission than we previously thought, right? With more than 65 million cases per year of dengue alone happening in Africa. And this is way more, 3 times the burden that WHO thought was actually happening. So this is really just undiscovered. But I've been working in Kenya since 2003. And since that time, we've seen a lot of these outbreaks happening in the areas that we're working with. And so there have been outbreaks in Mandera, which is sort of the refugee region up near the border of Somalia in the north. And then where I'm working on the south coast, near Mombasa, we've seen almost yearly outbreaks of dengue over the last few years, and often chikungunya outbreaks too. So, why is this happening? What can we learn from it? And what can we do about it? And so we started an NIH R01 study back in 2013, where we started enrolling children in 4 study sites in Kenya. So 2 on the west side in Chilimbo, which was our rural village site in the west side of Kenya, and Kisumu, which is the 3rd largest city, sitting on the borders of beautiful Lake Victoria there, as you can see in that photo. And then 2 on the south coast, the urban site Akunda and the rural site Msumbweni, which is on the Indian Ocean coast. And we started enrolling children, healthy kids, about 600 kids in each of these 4 areas. And then we enrolled children coming in with fevers at our health centers in these 4 areas to try and understand really the incidence of febrile disease and also the prevalence of these infections over time. And so what did we find? So we found a lot of things. Well, first and foremost, there's still a lot of malaria, both asymptomatic and symptomatic malaria. So in our Western sites, with children coming in with fever, about 80% of them were malaria blood smear positive. And healthy kids running around with no fevers at all, in the rural village, about 50% of them had parasites in their blood. So still a lot of asymptomatic and symptomatic malaria overall. But there was still a lot of overdiagnosis of malaria. So again, the mantra was that if it was fever, it was malaria. And so even when a malaria test was negative, oftentimes patients would still take antimalarial drugs, and a lot of antibiotics were often prescribed, leading to, potentially continued pandemic of antibiotic resistance in the world. We found that although the testing for malaria had become more widespread, definitely we needed revisions to the guidelines and really just better diagnostics so we could rule in other infections other than malaria in our healthcare settings. We found a lot of exposure to dengue and chikungunya. So about 10% of the kids overall were exposed just by serology alone. And we found outbreaks. So when we first started testing, we first got PCR up and running on our Western site. The first 20 out of the first 100 samples we tested, about a quarter of them were PCR positive for dengue. And we thought something might have been wrong with our methods, or maybe there was a contamination issue, but actually no. What we discovered was that there was an unrecognized dengue outbreak that was actually happening at that time, a dengue 2 outbreak. And we also had chikungunya outbreaks. So on the coast, most recently, we had a very large outbreak of chikungunya. And we found that both of these viruses actually co-circulate with malaria, which makes it really tricky and actually changes the way that disease presents itself, with those co-infected kids being sicker. In particular, what's important is that when kids come in with undifferentiated fever, 40% of them actually had dengue viremia, and half of those actually had malaria in their bloodstream. So we were able to find all 4 dengue subtypes in Kenya, and just a lot of ongoing transmission that was being missed in the health centers and sort of masquerading as malaria. We also do a lot of vector sampling during our work in Kenya. So along with all of that human surveillance, we were also trapping vectors at all their life stages every month for many, many years in Kenya to try and understand the vector ecology and what mosquitoes were spreading these viruses and when and how and why. And what did we find for the vector findings? Well, we found that Aedes aegypti lives for about 24 days in field conditions, and that the chances of being bitten is really much higher in the afternoon than the morning hours. We actually did 24-hour collections and human landing couch collections to really show us that these mosquitoes prefer to feed from 5:30 till 7:30 in the morning, and then from about 3:30 till 7:30 in the evening. And again, these are times when people are not under their bed nets. Chicken dengue were definitely being spread vertically in the vectors. So when we tested a lot of mosquito pools and male mosquitoes, right, which have never blood fed, of course, and then immature females who have never blood fed, we actually found a lot of positive mosquito pools for both chicken dengue, confirming that this is spread transovirally in the vector. And that can have an important implication for transmission in our study sites as well, and leading to this sort of low-level ongoing endemicity that we see in Kenya. And then we found that Aedes aegypti was really abundant in our study sites and spreading these diseases, and that it was found mostly outdoors and preferentially breeding in just a few containers. So we're looking at, in these figures here, just the protective containers in Kenya on the coast and in the west. And what's important to note is that there's just a few types of containers that are responsible for a very large percentage of pupae. And pupae are a good measure of pupal productivity. It's a good measure of adult mosquito abundance and disease risk, right? Because the pupae is the stage right before they sprout their wings, fly out, and bite you. And so we found that there were just a few containers that were really harboring most of our mosquitoes. So it was really time to intervene, right? We had sort of uncovered this large burden of disease. We understood risk factors. We understood a lot about the transmission in humans and what was going on in the vectors. And so it was really time to try to stop it and prevent it. We knew that arboviral exposure is common, going unnoticed. We knew that our mosquitoes were alive and well and breeding in specific containers, right? And so we thought we might be able to target those containers to prevent a lot of the disease. And so we started by doing our very first intervention study led by Jenna Forsythe, smiling there in a blue shirt, who's a PhD student at the time at Stanford, to really try to engage schools and community to reduce mosquito-borne mosquito-borne disease risk in rural Kenya. And you'll see later, we ended up calling this study Trash to Trees. So first and foremost, as I've sort of hinted at, these mosquitoes, Aedes aegypti, are container breeders, right? They actually love to feed on humans. They love to live in and around us, and they preferentially like to breed in our man-made containers, specifically plastic containers that we have laying around our households. And we know in coastal Kenya that there's a large percentage of people who are interested in protecting themselves against mosquitoes for their health. For instance, about half of them are using bed nets, but only 15% of them are practicing larval source reduction, which is that activity, what you do to get rid of your day biters, right? Dumping out standing water, the dog dishes, the flower pots, the water containers, so that these mosquitoes aren't breeding in your neighborhood. And so what we wanted to do is just take this invisible risk and really make it visible to our community members and our students. So we designed an intervention study to understand the existing barriers and facilitators of household source reduction. And that informed the development of a school and community-based intervention strategy, which we then trialed and tested the intervention in schools and community-based settings, and then improved it and reiterated the design and constructed studies in urban and rural settings to, again, promote better understanding of the existing barriers and facilitators of household source reduction. And this was funded through a Stanford Faculty Scholars Project. So what our formative research taught us was that a lot of people in our communities knew about malaria, right? Malaria prevention really predominated. Most people were concerned about night-biting mosquitoes. They knew that they needed to get under the net to prevent that, but they had really limited awareness of the mosquito life cycle, the daytime mosquitoes that were also a risk to their health, and source reduction as a preventative behavior. And when we did our entomologic work that went along with all of these focus groups, we found that larvae were breeding in many containers, particularly these containers, right? Which look like this, right? So sometimes trash, laundry containers, containers used for sanitation, and so forth. And we were working with a lot of entomologists, and entomologists often will classify, as I have been, about the mosquito breeding happening in a certain container, right? But it turns out when we looked a little deeper, it really wasn't the container type, right? It wasn't so much that this bucket, they really love to breed in this bucket. It was the fact that the water in that bucket didn't have a purpose, right? So it was really the purpose of the water in the container that really was the link to all of the mosquito breeding. And we found that 81% of our larvae were actually found in containers that didn't have a purpose. So this is either trash, tires, containers that are just laying around where the water isn't being used and replenished frequently. And so we designed our intervention, right? We went out to community members and did door-to-door awareness buildings with mothers. And then we worked with those children, the children of the mothers in their schools. These were like 4th grade students. And we spent a week with them, giving them lessons on mosquitoes and their life cycle, the diseases that they can carry, and then the ways to prevent, right? The ways to prevent exposure. And so over about a year, we found that, by 3 months, the intervention arm had significantly more knowledge and self-reported behavior than the control arm. And by a year, again, more knowledge, self-reported behavior, and people were practicing source reduction techniques more often in that intervention arm than the control arm. And as part of the study, we were really kind of focusing on children and as agents of change, right? And so we really were working a lot with the kids. We were teaching them games. We had a really fun curriculum where we taught them the mosquito life cycle through a game of mosquito tag that Jenna made. And we made them sort of like mosquito scouts. We gave them badges because they knew how to prevent mosquito breeding in their areas. And part of this project, every day after we would teach them, like on Monday, about the life cycle, we would send them home with homework. And on that very first day, we said, okay, now that you see that mosquitoes breed in water and they look like these little wormy things when they're larvae, go out into your communities and see if you can find any of these mosquitoes. And so the next day, the kids came back to us and were like, we found them. And we're like, where did you find the mosquitoes? And they said, in the piles of plastic trash behind our houses. And so Jenna and I were like, now what are we going to do? So then we added on an intervention to our study, which was sort of a community tree planting and community trash cleanup activity. And so we took these 250 school kids from these 5 elementary schools, and we kind of pitted them against each other and gave them sacks and asked them to sort of collect the plastic trash. And what happened over this month is that they collected over 17,000 containers, leading to over a ton of plastic waste that was removed from local communities. And we tried to repurpose as much of that plastic as we could. And we actually grew native tree seedlings in those plastic containers. And we planted over 4,000 trees in the communities and around in the school yards of where these kids were going to school. And this is just a picture when I was in Kenya last July. Our trees have grown now, so they're really tall. We have these little forests almost that we've created around our schools and in our neighborhoods. And these are the trees they wanted, and those are the trees that they got. And so, this was all great. Like, we're planting trees, we're cleaning up, wonderful. But you'll notice there's a big difference here between 17,000 and 4,000. And so what ended up happening is we still had a ton of plastic waste to deal with at the end of this. And there's no formal recycling in Kenya. And so we had to either burn or bury a ton of plastic waste. And so we ended up burying it, but we didn't feel good about it. And we knew we needed to do something more. And so we had these conclusions, which are sort of like the scientific conclusions, but actually the real conclusions were that respondents had a lot of barriers to continued source reduction and proper container management. And we did a lot of post-intervention qualitative interviews to really find out those barriers, and really what the barriers to behavior change were the behavior of others around, and then just the sheer number of containers that people had to deal with, along with their other household duties. And truly that structural changes, such as improving access to reliable water and solid waste collection and disposal services, would probably have a lot more impact than trying to rely on household behavior change to reduce mosquito breeding in our communities. And so this brings me to the plastic crisis. So in many parts of Kenya and in many other countries of the world, solid waste is really poorly managed. And population growth hasn't really been met with improvements in waste management, right? So you have increased consumption, you have increased people, but the waste practices aren't keeping up. And production and consumption of plastics is actually disproportionate, right? So in these almost 25 years here, plastic consumption quadrupled in Nairobi, but the corresponding population only tripled. So not only is the population getting huge, but per person, we're using more and more plastic, right? And the problem is that plastics don't biodegrade, and that more than 60% of the solid waste remains uncollected. Only about 5% is actually recycled. Across the world, only 9% of plastic is actually recycled. And so this takes us back to really the dawn of the plastic age, right? This is a now kind of really haunting photo of a 1955 American family celebrating the dawn of throwaway living, thanks in part to disposable plastics, right? And so this was celebrated. And what's happened since the 1950s, when we had no plastic before then, it's really just exponentially increased, right? So there's just more and more and more plastic we're using, and more plastic that's building up and then causing health threats. Plastic waste really impacts many sectors, right? Of course, it has an impact on the environment with biodiversity loss, marine ecosystem loss, the fact that plastic is actually made of oil, right? So the production of plastic is itself a greenhouse gas emission. In Kenya, especially where I'm working on the South Coast, tourism is big business. And of course, plastic and trash laying around leads to like unsightly areas and affects tourism. Which then affects the economy, of course. And then plastic, of course, has impacts on health. So I've been talking about disease in particular and how plastic, which most people don't think about, but plastic itself can be a breeding ground for these vectors, right? But also, as I mentioned, we had a choice in Kenya to either burn or bury our plastic, right? So a lot of plastic in the world gets burned because there aren't good enough waste disposal services to deal with it, right? And that, of course, leads to a lot of air pollution, a lot of asthma, respiratory diseases, and is in part contributes to over 6 million deaths from air pollution worldwide. And then, of course, I'm on the ocean working there. Microplastics really attract hydrophobic pollutants and get ingested by humans, right? So we find plastic in our water, in our food. Supposedly we eat a credit card of plastic quite often. And so this can have an impact on our bodies and our chemical processes within our bodies, and then an impact on food security, where we're harming ocean ecosystems and really threatening marine food chains and our food chains and sustainability, right? So our research, as I've shown you, we're doing initially, human disease surveillance, starting with sick children, which led us to all of these mosquitoes, which now has led us to all of this trash, right? And we've done work at our trash dumps, really trying to understand how they impact vector ecology in our settings. And we find that we capture the highest numbers of mosquitoes around trash, right? And this trash is, of course, very close to human dwellings, right? And so the consequences of this, of course, are a substantial avoidable burden of illness due to arboviral illnesses, right? Where more than 50% of our community is actually exposed. And it's all because of this bad girl, right? And the fact that she loves to feed on us, she likes to breed in plastic, right? And really cause all this disease and be a very efficient, really spreader of these viral diseases. And it's only gonna get worse because it turns out that bad girl, Aedes aegypti, likes it hot. And so as our climate warms because of global warming and climate change, right, and greenhouse gases, there's going to be more and more habitat for that bad girl, Aedes aegypti, in the world, right? And not only more habitat, but more months suitable every year for her to transmit disease to us. It turns out that the malaria vector, Anopheles gambiae, prefers to do its dirty work at 25 degrees Celsius, right? So it prefers it a little bit cooler. But the dengue mosquito, Aedes aegypti, actually prefers it around 29 degrees, right? So again, she likes it hot. And so what we actually predict is going to happen in sub-Saharan Africa as a whole, as the climate change continues to promote warming, is that we're actually going to get a shift from a lot of endemic malaria to a lot of endemic dengue. And you can see here, malaria burden will kind of shift across the continent, as some places maybe get a little too hot for transmission to occur and other places become just right. And then dengue suitability will just grow and grow over time. And this is unfortunate and scary because as a whole, sub-Saharan Africa is fairly unprepared for this because there is not a lot of vector control that's directed against Aedes aegypti. It's purely in Kenya directed against the malaria mosquito with bed net distribution. And so again, that's not going to help with dengue transmission. So what do we know here? So I've told you we've got these mosquitoes, they're spreading all of these viruses that impact human health. These mosquitoes like to breed in trash. And there are actually a lot of studies out there that have demonstrated that plastic waste is associated with dengue and chikungunya, including ours. And we know that intervention-based studies with strong solid waste component, like solid plastic waste sort of disposal components, demonstrate a great potential for trash disposal as a control strategy for this mosquito. So this led us to our next project, which we called Trash to Treasure. And this is collecting trash for profit to reduce vector breeding sites in Kwale County, Kenya. So again, the South Coast in particular of Kenya has experienced really significant population growth. And we and others have described waste management systems and household waste generation behavior. But really, if you just focus on those behaviors, but not really ways on improving the efficiency of waste reduction, recovery, and recycling, you're not really getting to the meat of the problem, right? We know that these activities, reducing, recycling, and reuse of solid waste is minimal, but there's a big potential for scaling up. And again, a lot of the waste is just sitting around causing problems, right? So there's a lot of opportunity here because all of that waste sitting around causing disease, right? Mosquito breeding and leading to disease, cleaning it up could reduce disease. And although reducing and recycling is minimal, there's really that potential for scale up, and scaling up could lead to economic opportunities, jobs, thriving livelihoods. And we have recycling in Kenya. We have models for the plastics because glass and metal are nearly 100% recycled, right? So we set out to do this project, and what we really wanted to do was assess the potential for community-based recycling that engages aspiring entrepreneurs to repurpose trash for profit in our area. And we wanted to improve health by reducing arboviral disease transmission, and then also alleviating poverty by generating income along the recycling trade. And so we were looking for community targets, identifying volumes of waste, scoping out local industry, intermediates, and potential, and then kind of linking people in the informal trash trade with entrepreneurs and piloting a business incubator program to really connect people and to identify market opportunities and then assess the effect of that business incubator intervention program on their profit margins and mosquito disease burden and mosquito abundance in our communities. And what we're trying to really do here is actually create a circular economy for plastic waste where we're working in Kenya, right? So right now, trash just builds up and causes disease. But if there could be an economy where trash is collected and it's given a purpose and then it's sold or reused in some way and you get new profits to collect more trash, you could see that by doing a circular system like that, we could really reduce disease burden and we could really potentially really increase economic growth in our area, where about 40 to 60% of people are unemployed. So we had a lot of focus group discussions with all the important players in this trade. We talked to public officials and yard shop operators. Those are the people who have sort of shops where they actually collect trash and try to do something with it. And then we have the waste collectors, community members, and other stakeholders. And we really identify that infrastructure for storing trash was insufficient and inconvenient, that community members didn't see any value in trash and kind of actually stigmatized the handling of waste. and that the yard shop operators and waste collectors were facing a lot of challenges that impeded their work, and that policy didn't really support a culture of recycling in our area. And so although there was no formal recycling trade in Kenya, through this study, we really got to deeply know the informal recycling trade in Kenya. And what happens is, in Kenya, and actually probably in many parts of the world, there are waste collectors who go out to large trash dumps or go around communities picking up waste which might be valuable. And then they sell that to these yard shop operators, which are the people who I mentioned have these little areas where they sort and store all of this trash that then they end up selling to traders or middlemen, who then sell to just a few recycling plants that actually make products out of repurposed plastic in very large cities like Nairobi. And so we focused our efforts really on this level at the yard shop operators, which were sort of our local entrepreneurs and businessmen in the South Coast. And they had a lot of challenges, right? So they were worried about their business viability. They were getting harassed from county government about different permits that they needed and environmental issues. There was a lot of policy limitations. So there were problems with transporting and taxes and levies. There were health risks, right? They don't have PPE, personal protective equipment, and so they were always worried about getting hurt by sharp objects or just the diseases that are breeding in the trash. And then their motivations were purely economic, but we wanted to actually show them that they were actually doing a great community service in this work if they do it safely, because they're decreasing trash on the street that's breeding mosquitoes for their community members. And so our approach was to create this business incubator program. And we really, in that program, learned about the trade, improved their business management skills. We worked with the Technical University of Mombasa and the business school there to improve business management. We strengthened a lot of key relationships, both within the policymakers and these businessmen and among the businessmen themselves. And then we provided a lot of training on health, safety, and waste sorting practices and the impacts they were having on the environment and health. And this led to up to a 10% increase of plastic waste volume traded. So that means more plastic off the street, less fluctuations in prices, and more streamlined transportation of products, so more profit for our entrepreneurs, a really strong peer network so that they could support each other, and then also significant reductions in Aedes aegypti breeding. But there was a lot more action that was needed. So as I mentioned, the community didn't see a big value in trash, right? And there was that stigma against working in trash. So we wouldn't want to create more community awareness and really promote recycling behavior and reduce stigma. We need to still improve the waste infrastructure by streamlining recycling operations and making more available, and then also actually creating a market to incentivize the plastic recycling business, and again, really create a strong circular economy of plastic waste on the south coast of Kenya. We need to continue to push towards policy change, exploring policies that enable and support recycling, both at this county and national level. And then really finally, cultivate a recycling culture, right? Where everyone understands the important impacts on the environment and health and economy, and that this is something that's really a good idea to do. And so that led us to really launch a new nonprofit, which is called the Health and Environmental Research Institute Kenya. And this is a nonprofit that we just launched last year. And the reason why we did it is we can do a lot as researchers, promoting things and doing all the things that I mentioned on the last slide, but we can't do it all. And we really needed a different perspective and a different interaction with our community members and the important stakeholders on the ground to really affect change. And so we thought that partnering with a new nonprofit and creating a new nonprofit could really give us that opportunity for a new perspective and new directions. So again, the problem, pollution's choking the planet, and people in Kenya where lack of safe water and poor sanitation lead to infectious diseases and other environmental health risks. And these problems are really exacerbated by this strong cultural stigmas against collecting and working with trash. And so our solution is this new nonprofit, where the goal is to translate the power of all the scientific knowledge we've collected over the years working in this space into engaging messages that are really actionable in the community to change the trajectories of health for our community members and the planet. And so this is where we're working on the South Kenya coast. As you can see, it's gorgeous. The Indian Ocean is beautiful. And it's just a perfect place to do this work because a lot of the trash that builds up ends up into the ocean, right? So not only are we poisoning the land, but we're poisoning the sea. And so a lot of people love this ocean. They recognize it as an incredible asset and an environmental just gem for them to have, and they want to protect it. And so it really is helpful in order to help change mindsets around recycling behavior and reuse behavior. So this nonprofit was founded with my two long-term research collaborators, Dr. Francis Matuku in the center in green, and then Dr. Bryson Ndenga in blue. They are both medical entomologists, right? And so we have our CBO, which stands for Community Business Organization, which is nonprofit at the county level in Kenya. And these are our members here. The membership has grown down to more than 60 people. And I love this Margaret Mead quote, right? So we're really hoping to do great work in our little part of the world and in Kenya. And what we're hoping to do with this nonprofit is really build education and awareness around these issues and really empower communities to come up with solutions and actually help them build and grow and scale those effective solutions, and all the while destigmatizing trash collection and really cleaning up environments. And we're striving to really strengthen these relationships and create jobs and decrease the health risks related to mosquito and trash related health risks. And then again, really go for sustainability and a healthier planet. And so our first goals are to really build a community of engaged stakeholders. We're going to be hosting our very first large conference event in Kenya in March of this year, where we're going to bring together stakeholders in policy, in healthcare, in the ministries of health and education and environment, people who are already working in the recycling trade, influencers in the community, strong community influencers, and even artists. We have an art grant with a famous artist, Jean Shin, to actually repurpose trash into art. So we're going to try and get all these stakeholders together to really understand the challenges and also the potential collaborative opportunities that we can have together to push the work forward. We want to strengthen all the relationships we have and build new ones over time, and really empower our local community members to really understand the dangers of trash, but then also see the economic opportunity and the health opportunities in dealing with that trash. We're hoping to remove 10 tons of plastic waste from local communities before it's burned. So far, we've had we host cleanups every couple of months, and we've had 3 large cleanups where we've collected about a ton of plastic waste per cleanup. So we're doing good towards getting there. I think we'll get there actually quite soon and keep going. And then finally, our goal is to really cultivate a plastic recycling culture and mindset in coastal Kenya by creating all these economic opportunities, working with our policy makers to change policy, and then also change attitudes towards plastic trash. And again, we're going for this circular economy, right? No longer a linear economy where trash is just building up and building up and building up. One of the ideas we have, I recently submitted a grant, but I didn't get it awarded. So unfortunately, I don't have funding for this yet, is I would actually like to purchase this, which cost about $250,000, but it's an H2AD unit. It's a very large anaerobic digestion unit. And I don't know if you're familiar with these, but the way these work is you have the inside bacteria that are able to, break down waste and create energy from that waste. And so it turns out in 2016, in the trash heaps of Japan, a bacterium was isolated called Eikenella sakiensis, which can actually naturally biologically degrade PET plastic, which is the plastic water bottle plastic, which has no value on the plastic recycling trade market. And so these bacteria were able to break those initial very hard bonds to get to the energy source, which is plastic. Because again, plastic is made from oil, right? So it's packed with energy. If only we could harness that energy. And so these bacteria have figured out how to do it. And so what this PET unit can do is you can put in these trays of these bacteria, and then you take your PET plastic and you chip it up into small bits and you put it into the reactor. And in this H2AD unit, what ends up happening is the bacteria degrade that plastic and create this digestate, which is actually an incredible fertilizer to use on crops. It's like, and really a methane-rich biofuel, which can then be harnessed and put into anything you want. And so what we want to do, we want to harness that energy and actually hook up an aquaponics unit on the back end of this H2AD unit so that we could have a little local business where we're actually growing fish, which is a very sustainable source of protein and protects our oceans from overfishing, and then also local vegetables and medicinal plants. And so that aquaponics unit would be powered by the PET plastic that we put in the front. And so anyway, this is one of many ideas we have about all the different things we can do in our community to really start to create economic opportunities in the plastic recycling trade. So today I talked about some unmeasured factors in arbovirology that we don't normally think about, right? Mainly being solid waste, right? Which is what I talked about today, and the built environment and how important that is for disease risk and the environmental context of our work. But also I touched on governance, right? How education and control programs and other support really can make a very big difference in this work. And finally, there's a lot of structural factors, right? Just health inequities, poverty, violence that can actually impact the work and impact why things are the way they are in the world. And so I always like to bring up the fact that arboviruses are neglected tropical diseases, right? They are infectious diseases that are poverty promoting and long lasting, because as I mentioned in my very first slides, these diseases actually cause long lasting sequelae, right? And they definitely affect the impoverished more severely, and they promote poverty. And so we really are trying to, as part of this nonprofit and in the research work itself, really partner with our local communities to target the problems that matter for our local communities, making sure that our work is relevant and has purpose. And as we do that, we uncover a lot of the social and structural determinants of health that create these patterns in the first place, right? And these patterns are only going to worsen with climate change, right? The inequities of our world are only going to get worse as climate change is going to impact the most vulnerable among us. And so I feel like I'm ending here just by trying to say that global health practitioners like all of you, future practitioners, current practitioners, and researchers can really be climate and global health equity revolutionaries, right? And I believe this for a lot of reasons, and I'm just giving 4 here. But first, the biggest crisis of our time is actually not COVID, it's climate change. And although you may not recognize the impacts of climate in your work, it's there. And it's going to be there more and more. It's easy for me to talk about climate because I work with ectotherms and which the mosquito, right, which clearly is tied to ambient temperature. But all of us can probably look a little deeper and figure out the environmental context of our work and how that is going to shift both our practice and our research as time goes on and we deal with this crisis. I want to say as global health practitioners, we're also incredibly connected with our local communities, right? We're really truly in relationship with our communities on the ground. And so that is really helpful because we know what is important. We can really sit with important people at the table and find out what we should be devoting our energy and intentions to and really do that work. We're also systems thinkers, right? Global health lies at the nexus of complex problems. And so our world needs that. We need to continually use a systems-based approach to really think about these problems and get a lot of different people with different disciplinarities together so that we can really tackle these really complex global health challenges. And then finally, we're really proximate to the problems, right? I think we're very proximate. I feel very proximate to all the inequities and all the facets of all the work I do. And I feel like we have an opportunity when you're a person of privilege to actually put time and energy towards leveling the grounds and actually promoting justice and equity and inclusion and belonging in all that we do. So to conclude, I just first and foremost, pay attention to what your participants are telling you, right? Those kids told us where the mosquitoes were, we listened, and now we've uncovered a huge problem that we need to deal with. I feel like our work and arboviral research in general really uncovers opportunities for activism and advocacy, and I'm sure your work does too, and I hope you take those opportunities. Global plastic crisis has really important health and environmental impacts that we're just starting to know about and really need to think hard about using plastic and continuing to use it. We're hoping that this nonprofit here in Kenya is going to tackle this problem through education, awareness, and active engagement with local communities and policymakers. And then finally, global health practice and research provides a foundation of stakeholder relationships that can promote local health issues and tackle global health inequities. So I want to thank all of our study participants. Of course, without them, we would have nothing to be talking about and nothing to learn. We learned so much. And I also want to thank the many, many, many people that it took in Kenya to do this work. It really does take a village. There are people at my university. I mentioned Technical University of Mombasa. There's also the Kenya Medical Research Institute that we work with Bryson and Danga leading that. We had an intervention team. We work with Kemry and Melindy. And then I also want to thank Harry, the new kid on the block, our nonprofit. And I just have to highlight Japji Randhawa, who actually is a University of Alberta student who I've been working with over the last year on this. And so it's just really awesome that I got to give a talk at Japji's school. And then finally, our funding sources. So thank you very much for your attention, and I'd be happy to take any questions if there are any.